Your question. Hey doc, I'm helping my mother file for DIC. My dad retired from the military and received some disability benefits. I keep hearing Nexus letter and IMO. I'm not military. I don't know. Which one do I need in this case? Thanks. Jonathan L. Thanks for sending that question in, Jonathan. Welcome, veterans, families, caregivers, and surviving spouses. My name is CM Queen Williams. I'm a board certified radiation oncologist, Lieutenant Colonel, retired United States Army, prior enlisted 54 Bravo, now C. Bernie. As a veteran and cancer doctor myself, I help you, my fellow veterans who are diagnosed with cancer, understand what is needed when you are filing claims related to cancer for IMO, Nexus letter, and DIC. Today, I want to clear up two terms you may hear during the VA claims process, right? Nexus letters and independent medical opinion, otherwise called IMO. We will also discuss how a medical opinion may be used in a DIC claim after a veteran has passed away. Now, remember, this is general education and not legal advice. I do not work for the VA. I'm not a credentialed VA personnel. I am a veteran and a cancer doctor who worked with you on cancer and toxin-related cases. Every claim must be evaluated based on its own records and circumstances. First thing, what must the evidence generally show? This is your responsibility, right? So for direct service connection, there are three basic pieces. You need a current diagnosed medical condition, not what you think it should be. You need an injury, illness, exposure, or event that occurred during your military active duty service. And you also need a medical link, and that link is called a nexus between the two. VA described this third element as evidence of a link between your current disability and the in-service event or disease, and they want their evidence. So that then, summarize it up, a diagnosis tells a VA what condition you have, period. Your military records help establish what occurred during your active duty service. The nexus does the connection and address whether those two things are medically connected. This then leads directly into answering your question, Jonathan. What is a nexus letter? Sort of answered it earlier, but nexus again simply means connection or a link. So a nexus letter is written by a qualified medical professional, such as a pulmonologist for lung conditions, or let's say a urologist for urinary issues, or an oncologist or a cancer doctor like myself for cancer cases. A nexus letter answers specific medical questions, and some of these questions, not all inclusive, would be things such as, is the current condition directly related to military service? Was it caused by a service-connected condition? Was it aggravated beyond its natural progression by a service-connected condition? And is the condition related to documented toxic exposure? Watch my previous video regarding whether or not some of these fall into the PACT Act. Another word of caution, right? A nexus letter should not be just a diagnosis followed by the words more likely than not. It's the responsibility of your provider to identify the records that they review and explain the medical reasoning behind the conclusion. You have to explain it, right? So let's now talk about what an independent medical opinion is. So an IMO, on the other hand, is usually a more detailed, case-specific medical report. It may include the physician's qualifications, again, depending on the diagnosis, the exact medical question being addressed, there could be multiple, relevant military exposure and the medical history. They're going to want to know what records that the doctor actually reviewed because they also want a copy of it, they being the VA. Analysis of timing, risk factors, and alternative causes. That is so important. This must include reviewing the other risk factors. A good example, right? If a patient or you are diagnosed with lung cancer, but you're a smoker, it is the oncologist's positioning to explain this for you. Why is the toxin, such as asbestos, the cause of your lung cancer? What if it's bladder cancer? Must address the other risk factors in whichever condition is being addressed. Okay, so the relevant medical literature can help in that, but knowledge of the military and the process of a cancer diagnosis can help. And this must all be stated in the conclusion. This is not a one-pager. It's not a two-pagers. My last one was up to 15 plus pages. So in summary for these two, a Nexus letter may answer the question. A comprehensive IMO answer the question and carefully shows the medical work behind the answer. I think there's going to be work behind either one. Now, when might you need an IMO? A medical opinion may be helpful when the condition was diagnosed years after military service. Look at Agent Orange and prostate cancer. You're talking decades, right? The service treatment records do not clearly document the condition. So if you have kidney cancer, it may not say anything about that. The claim involves toxic exposure or terror. As a biochemistry in undergrad, this is like my niche. I enjoy doing that. The condition is not presumptive, right? So I have a lot of these cases where the claim is not covered under presumptive, but it's close and there's some aggravation or connection or multiple medical conditions or multiple risk factors. Look, these cases take work. It is not impossible. The VA may even ask for their own examiner and their own IMO to go over this. If a VA denied the claim because it did not find a medical connection, that's where these IMO comes in. However, take a note, not every veteran need to purchase a private Nexus letter or IMO. If the evidence clearly already established the required connection or the condition qualifies under the presumption of the PACT Act, another lengthy report may add very little, so you may not need it. VA may also obtain an examination or medical opinion when necessary to decide a claim. So, private medical records and physicians' reports may be submitted as supporting evidence. There are just certain things the VA require, and that's where your credential specialist can help you get that ready. Another question I get a lot is, well, where do this Nexus or IMO fit in the claim process? It truly depends, right? A Nexus letter or IMO may be submitted at various times during the process. You can submit it with your initial disability claim if it's been pointed out as something that you will need, with a supplemental claim after a denial, and in certain board appeal lanes that allow additional evidence. Now, this is very important, y'all. This is where we would stomp in the military, right? Very important. A higher level review does not allow new evidence. So if you already have a new medical opinion or plan to obtain one, a supplemental claim or an appropriate board review option may be more suitable. I'm going to repeat that again. A supplemental claim permits new and relevant evidence, while new evidence cannot ordinarily be added during HLR, higher level review. So my disclaimer here again, depending on when you're watching this video, things may change, right? So be sure to ask your VA credentialed personnel if a Nexus letter or IMO is beneficial in your situation, especially if an HLR is being considered. Now, today, it's unlikely that you need one, but rules and regulation changes. So please ask. This will segue then into DIC, right? So let's now consider how DIC would apply for these. So what's a DIC? DIC stands for Dependency and Indemnity Compensation. It is a tax-free benefit that may be available to certain eligible survivors. DIC may apply in multiple scenarios, and please know that's too much for me to go into, and it's beyond this introductory video. The ones I commonly work with, though, are some of what I'll discuss here. So a service member died in the line of duty, and later on you're discovering that, hey, I think I can get a DIC here, or you were told that. A veteran died from a service-connected illness or injury, or in certain circumstances, the veteran had a qualified total disability rating for the required period before death, even if the death itself was not service-connected. For a cause of death DIC claim, the medical issue may be whether a service-connected condition was the principal cause of death, so it was that connected lung cancer that caused the death, or a contributory cause of death. I had COPD and it led to lung cancer. These are just examples. Under the VA regulation, a service-connected disability can support the claim if it was the principal or a contributory cause of death, meaning the primary. There's also a time frame limit. I am not going to say it here because that may change. Talk to your VA representative. In a DIC case, the veteran is no longer available for an examination, right? So the physician, like myself, may therefore perform a retrospective review of the medical records, service history, death certificate, terminal hospitalization, treatment records, and any other relevant evidence. So that's just a lot to review, but I have done it on multiple occasions. And when you're doing, therefore, a DIC, some of the things that are needed, like the death certificate, if it does not mention a service-connected condition, it's important. The listed cause of death was never service-connected. You needed explanation and IMO. A service-connected illness may have materially contributed to the death. IMO, connect and explain. Treatment complication or multiple diagnosis make the medical relationship unclear. That's where, again, I come in with investigating. The survivor is trying to establish that the fatal illness itself resulted from military service. So there are all sorts of different things that can lead to a DIC claim, and that's why I invite folks to go through the VA strategy consult. Know that a DIC medical opinion, they should address the cause or contribution to death, not simply repeat that the veteran had a service-connected disability. I've been getting more and more second opinion having to do these. So the VA identifies death certificate, military records, doctor's report, medical testing, and relevant treatment record as potential DIC evidence. So there's a lot to be done, and you need someone who knows what they're doing on your side, especially in a DIC case. So Jonathan, the key question is not simply, do I need a Nexus letter or an IMO? The better question is, what medical fact is missing from the claim, and what evidence is needed to address that gap? A well-supported medical opinion cannot guarantee a VA decision, and anyone who guarantees you that, turn left and run. Its role is to provide a clear medical defensible explanation that the VA can consider along with the complete record. No guarantee can ever be made. I don't sit on the VA board. I know that I can give you the information that they are looking for in their language. If you would like assistance in understanding what's in your medical records, or you're not sure whether your documentation is saying what it truly needs to say, that is exactly the kind of physician-led review I do at Q4CD. Visit q4cd.com to learn more. And if this video helped you, please subscribe, share it. Someone you know is navigating a VA claim right now. They need this too. Let me know below in the comments topics you would like me to cover and or questions. I'm Dr. C.M. McQueen Williams. Thank you so much for allowing me to share this time with you. Until next time, please do take care of yourself. Peace and blessings on your journey. Bye.